The fluorescent lights hummed overhead, a sound like electricity trapped in glass, and Hannah Clarke hung the combat boots in her locker without ceremony. Worn leather. Creased at the arch. A scuff across the left heel that caught the light. She placed them on the metal shelf, side by side, and closed the door before anyone could ask. That's what she told the curious ones, her fathers. A lie that held the weight of 20 years. Sacred Heart Hospital's trauma bay smelled like antiseptic and coffee gone cold in styrofoam cups. The walls were institutional beige, the floors a grey tile that squeaked under her rubber-soled shoes. She'd chosen this place deliberately. Norfolk. Quiet. Far enough from the coasts where most of the brass still lived, where old contacts could track her if they tried hard enough. But not so far that she couldn't drive to the VA hospital in 18 minutes when the nightmares won. It was 6:13 a.m. Her shift started at 7. Hannah moved through the pre-dawn corridor with the kind of invisible efficiency that made her nearly impossible to notice. She caught what others missed: a missing four-pump, a contaminated sterile field, a medication error a new resident was about to make. She corrected the resident without making him feel small, which is why he would never remember her name. She simply appeared, redirected his hands, and disappeared back into the rhythm of the ward. This was her gift and her curse, competence so quiet it registered as background noise. Dr. Hargrove arrived on rounds at 8:13 a.m., his white coat pressed sharp enough to cut, his badge clipped to his chest like a medal of importance. Behind him trailed a resident, a medical student, and 3 nurses. They moved like satellites around a sun that had convinced itself it was the only thing keeping the system orbiting. "Hannah, these equipment orders," Hargrove said, not looking up from the tablet in his hands. His voice carried the particular edge of a man who'd never been told no. 6 defibrillators in 1 month? Explain the justification. The group stopped. Hannah looked up from the patient chart she'd been reviewing. Her hands were steady. Her voice, when she spoke, was soft, the kind of soft that made people lean in. "We had 3 units fail maintenance review. 2 were outdated models beyond repair window. The 6th is standard replacement inventory for a level 1 trauma center seeing our volume. Seems excessive." Hargrove scrolled through something. "Your documentation is thorough. Exhaustive, really. Some might say paranoid." There it was. The implication. The small cut designed to land in front of witnesses. Hannah's jaw tightened, but only for a breath. 1 measured breath. She'd learned to count them in Marjah when the shelling started and the wounded came in faster than the body could process adrenaline. "I document everything because lives depend on accuracy, Doctor," Hannah said. Her voice remained level, but something in it changed, not louder, but denser. More present. She wiped the corner of her eye with the back of her hand, a gesture so quick it could have been a tick. "I'm sorry if that philosophy troubles you." The medical student looked at her shoes. The resident found the ceiling suddenly fascinating. Hargrove's mouth thinned, and he turned away, moving the satellites with him, but not before Hannah caught the flush creeping up his neck. She'd landed something true, and he knew it. What she didn't let any of them see was what lived underneath the composure. What had started the morning she'd signed the separation papers 20 years ago, when the Navy handed her a discharge and a pamphlet about readjusting to civilian life. They'd wanted to make her a recruiter, a trainer. They'd offered her a pension bump to stay another 5 years. But she'd walked away because the faces of the casualties in Marjah had started appearing in her peripheral vision at stoplights, at dinner tables, in the shower when the water temperature hit a certain point. 2 deployments. 87 days total in the field treating trauma cases that came in faster than you could catalogue them. A 12-year-old boy with shrapnel across his left side, coughing blood onto her hands. She'd saved him. She still dreamed about his face, now 12 years older and folded into a grief she didn't have permission to process. That was the thing about PTSD that nobody mentioned in the VA pamphlets: the people you saved haunted you just as much as the ones you couldn't. The rest of her shift unfolded in the familiar rhythm. 2 car accident victims. A stabbing. A 68-year-old woman with chest pain who turned out to be fine, just anxiety and too much coffee. By 2:53 p.m., Hannah had treated a small city's worth of urgent suffering, and nobody in the hospital would remember her name by tomorrow morning. At 3:15 p.m., she clocked out and drove the 18 minutes to the VA hospital downtown. The waiting room smelled like old magazines and the particular scent of people who'd been breathing the same stale air for too long. Hannah signed in at the desk, not her real name, just the one she'd learned to answer to in civilian spaces. The receptionist didn't look up. She never did. That was the point. You came here and you were just another veteran, just another person who'd seen something that had rearranged the chemistry of your brain. She recognized one of them. A former Marine, maybe 35 now, probably early 20s when she'd first treated him in the field. His name was painted on his service record in her memory: Williams, Lance Corporal, femoral artery laceration, survived. He sat in a plastic chair reading a 2019 issue of Sports Illustrated, and she was grateful he didn't look up. Gratitude was the wrong word. Relief was closer. The psychiatrist she saw on Tuesdays was a woman named Dr. Morrison, early 50s, grey at the temples, the kind of calm that came from having already survived her own interior wars. They didn't talk much about the deployments. They talked about sleep hygiene and breathing techniques and whether the nightmares had frequency or if they were intensity-based. Hannah answered the questions with the precision she brought to everything. She was excellent at being a patient. She'd had a lot of practice pretending. "How's work?" Dr. Morrison asked, pen poised over a notebook. "Fine." Hannah's hands rested on her thighs. She noticed they were trembling, just slightly, just enough to see if you were looking. "Administrator." "The usual." "The tremors are back." "They're not." Hannah stopped. Lying to her therapist had a diminishing return. "Yes." "For about a week." "Triggered by something." Hannah thought about Dr. Hargrove's voice, the way he'd said paranoid like it was a diagnosis. She thought about how easy it would be to slip backward, to let the competence falter, to let someone like him know that underneath the scrubs and the quiet efficiency lived something fractured. How quickly they'd move her to desk duty, and then to medical leave, and then to a discharge that would make it official, unfit for service. "Work stress," Hannah said. Dr. Morrison wrote something down. "You know you can be more than a trauma nurse, Hannah. There are other paths. Nursing administration. Teaching. Your CV is. I'm fine where I am." And that was the truth, in a way. She was fine exactly where she was because nobody here knew that the combat boots in her locker weren't her father's. They didn't know that the way she moved through the hospital had been trained into her muscle memory by people whose names she wasn't allowed to speak. They didn't know that the scars on her hands came from shrapnel, not accidents. They didn't know she'd once held a compression bandage on a child's abdomen while rounds came in close enough to rearrange her hearing. She was fine. She was fine as long as nobody looked too closely. The session ended at 4:51 p.m. She drove back to the hospital to finish some charting she'd left undone. The evening shift was already settling in, the day shift peeling away like old paint. Hannah moved through the trauma bay, her presence so familiar nobody even turned to acknowledge her. She pulled up the equipment inventory system and rechecked the defibrillator data. 6 units. Logged. Accounted for. Documented with the kind of granular detail that would survive an audit, a lawsuit, or a 3-year federal investigation. But that wasn't the worst part of what she'd hidden, and she knew it, sitting alone in the nursing station with the sounds of the hospital moving around her like blood through a living heart. The nursing station fell quiet around 2:13 a.m. Hannah had finished her charting on the patient from room 412, a 63-year-old with septic shock who'd arrived 12 hours earlier. She documented everything. Vitals every 15 minutes. The exact timing of antibiotics. The fluid balance. The equipment used. 6 defibrillators ordered in a single month. All 6 sitting in the supply closet gathering dust. She printed the sheet. Stapled it. Filed it in the chart. That's when she saw her name on the unit board. The white laminate card was impossible to miss, posted at eye level next to the staff schedule. Hannah Clarke. Below it, in Dr. Hargrove's precise handwriting, written reprimand. Insubordination. Questioning department ordering procedures. Her hands did not shake. She read it twice. Once for content. Once to commit every word to memory, a habit from Afghanistan where written orders meant the difference between a supply airdrop and a casualty count. She pulled the card down. Walked it to the break room. Dr. Hargrove stood there, pouring coffee like he'd been waiting. He looked up. Smiled. The kind of smile a predator shows when it knows the prey has nowhere to run. Surprised. His voice carried the casual cruelty of someone who'd never faced consequences. 42 years old, Ivy League heritage, family money that predated his medical degree. His grandfather had been a surgeon. His father a hospital administrator. Hargrove had walked into authority the way other men walked into inheritance. You questioned my procurement decisions in front of 3 RNS. That's insubordination. That's the write-up you earned. Hannah set the card on the counter. The 6 defibrillators are not your concern. You document. You execute orders. You don't interrogate department leadership? He stepped closer. His cologne arrived first, something that cost more than her rent. I'm beginning to wonder if your obsession with detail might be something else. Something more concerning. She met his eyes. Breathed once. Paranoia, he said, letting the word hang. I'm seeing signs of paranoia. Hypervigilance. You notice everything. You trust nothing. You question everyone. Do you know what that looks like from up here? He tapped his temple. It looks like someone who's not stable enough for this level of responsibility. The break room door opened. 2 nurses from the night shift, Melissa and Janet, stopped. Saw Hargrove. Saw the reprimand card on the counter. Saw Hannah's face, which showed nothing. Morning, Hargrove said brightly, turning to them. I was just explaining to our detail-oriented colleague here that we all have our breaking points. Some people handle stress better than others. Some people's minds get a little fragile. He left. The coffee maker gurgled behind him. Melissa and Janet filled their travel mugs in silence. Not looking at Hannah. Not speaking. They left through the back door, the one that led to the loading dock. Neither sat down. The break room had the antiseptic smell of cleaning solution mixed with the ghost of 1,000 microwaved lunches. Hannah threw out the reprimand card. Watched it fall into the bin beneath used napkins and a plastic fork. She clocked back in at 2:51 a.m. The next morning, she was assigned to patient rounds with Hargrove. Room 307 held a 58-year-old cardiac patient post-stent placement. His wife sat in the corner chair, hands folded, watching everything. Hannah changed the foot dressing. She'd done this procedure 8,000 times. Maybe more. Her hands moved through the choreography, sterile field, chlorhexidine prep, fresh gauze, clear dressing, smooth application. No hesitation. No error. The kind of technical execution that came from repetition burnished into muscle memory. She was smoothing the final edge of the dressing when Hargrove stepped in. Stop, he said. Loud. The wife's head snapped up. That's not sterile technique. Hannah's hand stilled. She'd already sealed the dressing. The procedure was complete. She turned to face him. Your left hand crossed the sterile field twice. That violates basic protocol. He spoke like he was lecturing a student nurse in her first rotation. Like Hannah wasn't holding a certification in trauma nursing. Like the patient's wife wasn't staring between them trying to understand what was happening. You've contaminated that line. We'll need to restart. Hannah looked at the dressing. Looked at Hargrove. One measured breath entered her lungs. The sterile field was maintained throughout the procedure, she said quietly. The dressing is clean and properly applied. Are you arguing with me about sterile technique? In front of the patient's family. The wife's hands had stopped being folded. They gripped the chair arms now. No, Hannah said. She said it the way you say it when you're accepting something you can't change. Not angry. Not hurt. Just accepting the weight of it. I'm not arguing. Hargrove ripped off the dressing she'd just applied. Balled it up. Threw it away. Then he turned to the wife. We had a small lapse in technique. It's handled now. Your husband is in good hands, even if those hands occasionally need reminding. He left. Hannah pulled out a new gauze pad. Her fingers moved through the same sequence. No tremor. No hesitation. The wife watched the entire procedure without blinking. When Hannah finished, the woman said, "That was perfect, wasn't it?" Hannah disposed of the contaminated materials. "Thank you for letting us take care of him." She clocked out at 7:06 a.m. The break room became a place Hannah stopped going. She'd arrive, open the refrigerator to grab her lunch container, and within 90 seconds she'd hear conversations die. 3 days in a row, Melissa and Janet arrived together. Saw Hannah at the table. Exchanged a look. Grabbed their food and left through the back exit. By Friday, the pattern was established. She was the thing staff moved around. The patient everyone was uncomfortable near. The presence that made the air in the break room change. Hargrove had never said anything explicit. He'd simply created a space where Hannah's existence became an inconvenience. Meantime, she documented everything. The 6 defibrillators bothered her? Bothered her the way an itch bothers a person who can't scratch it. She began cross-referencing the equipment logs against the actual supply usage. In 3 months, the trauma department had charged for 42 units of equipment. She counted the same units being restocked multiple times in the system. Devices that shouldn't have been damaged were listed as defective. Supplies that never appeared on actual patient charts were documented as used. She created a spreadsheet. Dates. Equipment types. Serial numbers. Bill codes. She documented it all the way she documented casualty metrics in Marjah, with the kind of precision that survived scrutiny. She had no idea what she was building. Not yet. She only knew that lies lived in the gaps, and gaps were places where people died. On her shift that Saturday, around 2:38 a.m., the trauma bay doors exploded open. A Marine arrived on the stretcher, 26, compound leg fracture, bleeding out, breathing shallow. The trauma team mobilized. Residents. Attendings. Nurses. The organized chaos of people who'd trained for this exact scenario. Except one of those trained people was panicking. Dr. Hargrove stood over the patient, hands shaking as he reached for the instrument tray. "Get me a chest tube set up," he said. His voice had lost its authority. It sounded thin. Fractured. The patient's O2 sat was dropping. 88. 83. The monitors screamed their electronic warning. Hargrove's hands fumbled with the tube. He was going for the wrong site, inserting at the 4th intercostal space when it should be the 5th. The tremor in his hands wasn't surgical precision. It was panic. Something shifted in Hannah's body. It happened the same way it always happened, without announcement or permission. Her mind went somewhere else. The trauma bay became transparent. Through it, she could see the courtyard of Marjah Hospital, the mortar fire turning evening into daylight, dust in her teeth, a kid with shrapnel in his femur asking in Pashto if his legs would still work. The smell became copper and burning diesel. The heart monitor became rocket fire. She blinked. The desert was gone. She moved. Not fast. Not dramatic. Just moving the way someone moves when their body has done this 1,000 times before. She was beside Hargrove. She took the tube from his hands. Step back, she said. That's not protocol, Hargrove started. She was already positioning. Already finding the fifth intercostal space with her fingers, palpating the landmarks the way she'd palpated the landmarks of wounded soldiers on an operating table with no electricity and no backup. The tube went in smooth. Exact. The hiss of air escaping told her the pneumothorax was releasing. She secured the tube. Taped it. Called for the chest X-ray to confirm placement. O2 sat climbed. 85. 90. 94. Stable. The patient was breathing easier. The panic in the room reversed itself, became control again. Hargrove stood at the edge of the trauma bay, watching Hannah finish the procedure with the mechanical efficiency of someone who'd done emergency medicine in a battlefield hospital for 2 decades. She didn't acknowledge him. She didn't look at him. She simply worked until the patient was stable, until his bleeding was controlled, until he was ready for the OR. Only when the stretcher was moving toward the elevators did she pull off her gloves. Disposed of them. Walk back to the nursing station like her hands hadn't just saved someone's life. The room went so quiet you could hear the fluorescent lights hum. Hargrove's face had gone white. He'd seen something in those 90 seconds. Some muscle memory that didn't match a floor nurse. Some competence that exceeded a hospital employee. But that wasn't the worst part for him. The worst part was that he didn't know how to kill something that had already survived everything. The fluorescent lights flickered overhead as the afternoon shift wound toward the dinner rush, staff moving through the trauma bay with the practiced efficiency of people who had stopped being surprised by anything. Hannah was restocking a supply cart near Bay 4 when the doors exploded inward. Not opened. Exploded. The sound of 130 kilograms of human rage crashing through reinforced glass, followed by the sight of a man, 6'3", chest heaving, eyes dilated black as wells, holding a tire iron like a club. His mouth was moving but the words weren't words, just animal sounds, the kind of noise that triggers something primal in the hind brain. A scream that asked no questions, demanded no answers. Dr. Hargrove was somewhere in the back, dictating notes. The residents scattered first. Then the nurses. The attending physician reversed into a supply closet so quickly her stethoscope tangled around her neck. Someone hit the panic button. The overhead speaker crackled, security response in progress, estimated 3 minutes. 3 minutes felt like eternity when a man high on methamphetamine was swinging iron at kneecap height. Hannah set down the 4 tubing she was holding. The motion was deliberate, not fast. 1 second of inventory. The man was moving toward the central station, toward the monitors, toward anywhere that was not forward. She recognized the pattern. The wide stance. The way his weight shifted to his back foot before each swing. This was someone looking for a target to authorize the explosion already inside him. That was useful information. That was data. She stepped into his line of sight. The movement stopped everything. Not the man, he didn't see her at first, or rather he saw her but his brain needed a moment to process that a woman in scrubs was now directly between him and the nursing station, hands visible, low, palms open. No weapon. No defensive posture. Just presence. The kind of presence that made the air pressure change. Hey! Her voice. Not loud. The kind of quiet that made people listen because it was the opposite of what they expected. Hey! I see you. His head swung toward her. The tire iron came up. Hannah didn't move. Didn't flinch. The muscle memory wasn't from the trauma bay. It was from Marjah, from the dust-choked aid station on forward operating base Shank where a 17-year-old Taliban fighter had come through the door wounded and furious, convinced everyone inside wanted him dead. She had talked him down then too. Hands visible. Voice steady. No fear, because fear was a lie she had learned not to tell herself. Fear didn't help the patient. Fear was self-indulgent. You're in pain, Hannah said. The drug is making it worse. I can help with that. The man's breathing was raw, chest heaving like bellows. Sweat poured down his face in rivulets. His hands were shaking, not from fear, she knew. The trembling wasn't fear. It was restraint. The drug was forcing his nervous system to operate at maximum capacity, and his body was struggling to contain the electric chaos. Every muscle fiber was screaming. "You need to put that down," Hannah continued. Same tone. Absolutely level. "You're going to hurt yourself." "Back away, you crazy," someone called from across the room. Hannah didn't acknowledge them. Her entire attention was on the man, on reading the micro-movements of his shoulders, the dilation of his pupils, the rhythm of his breathing. She had been trained for this. Not with a nursing degree. With 19 years of triage protocols in hot zones, with learning to read patients who couldn't or wouldn't speak because they were too deep in shock or rage or the kind of fear that bordered on transcendence. "My name is Hannah," she said. "What's your name?" He didn't answer. His breath was fast now, maybe 90 beats per minute from the exertion, his oxygen saturation probably dropping as his muscles demanded more than his lungs could deliver. The tire iron was still raised, but it was wavering now, the initial surge of adrenaline beginning to compete with pure physics. Physics always won eventually. "I'm not going to hurt you," Hannah said. "I'm not going to judge you. You're sick right now. The drug is making your brain tell you lies. I can help stop that." 30 seconds had passed. The man's eyes were still locked on her, searching for the threat. He was a predator shaped like prey, dangerous because he was frightened, and frightened animals were always the most unpredictable. She took one step closer. Not sudden. Just a slow migration of weight from back foot to front. "We have a stretcher right over there," she said. "You can lie down. You can rest. No one is going to force you. You can control this." The tire iron descended maybe 2 inches. Not much. Just enough to suggest the possibility of surrender. "What you're feeling right now. That's your body running too fast. We can slow it down. We have medication that will help. You'll feel better. The panic will stop." The security guards were 20 feet away now, maybe closer. Hannah kept her hands visible, kept her posture open. If he saw them approach, if his brain registered uniforms and authority, the calculation would flip. The rage would intensify. She had 90 seconds to talk him from the edge before backup arrived and made the problem worse. "You trust me?" she asked. His mouth opened. Closed. A sound came out, something between a word and a sob. "Okay," Hannah said. "Then we're going to walk together. The stretcher is right here. You're going to lie down. I'm going to stay with you the whole time. Nothing is going to hurt you. You're safe." The tire iron fell. It hit the floor with a sound like a church bell, sharp and final. The man's legs gave out and Hannah was already moving, one hand under his arm, the other supporting his waist, her body angled to absorb his weight. She had caught falling soldiers in field conditions. This was muscle memory. This was what her hands were made for. "Stretcher, now," she called out. Not a request. It was a command, and the voice was different now, deeper, the kind of tone that military personnel recognize without knowing why. The residents who had been hiding emerged from behind curtains. One of them started and fall line while another began the initial assessment. Pulse, 118. Respiratory rate, 26. Blood pressure 162/104. Temperature 39.4 degrees Celsius. Methamphetamine-induced psychosis, likely hypothermic crisis. The ticking clock was already running. Hypothermia at this magnitude could cause rhabdomyolysis, could shut down his kidneys, could turn this man into a medical catastrophe in the next 30 to 40 minutes if she didn't get his core temperature down. "Cooling protocol," Hannah said. The words just emerged, automatic. "Ice packs to groin, axilla, neck. Push 2 liters normal saline wide open. Get a Foley. I want urine output monitored, rhabdo protocol. Dr. Hargrove appeared in the doorway of Bay 4, his face pale, his hands empty. He watched as Hannah moved the patient onto the stretcher with the kind of coordinated efficiency that made the chaos look like choreography. She was already securing his wrists with soft restraints, not for punishment, but for his safety and for theirs. Her hands moved with the terrifying fluid precision of someone who had practiced this kind of stabilization 10,000 times. The patient's eyes were still on her as they wheeled him toward the intensive care unit. "You're going to be okay," Hannah told him. "You're going to get through this." And the smallest part of her, the part that had never stopped being a medic, knew it was true. His vitals were already stabilizing just from the reduction in panic. His heart rate had dropped to 102. His respiratory rate was coming down. The drug was still in his system, the chaos still burning through his neurons, but something had shifted. He had a name now instead of just a threat. He had been seen. The security guard stood in the trauma bay, the tire iron still on the floor. The other nurses were staring. The attending physician had emerged from her supply closet, her expression unreadable. Dr. Hargrove was still in the doorway, his mouth open slightly, watching Hannah disappear around the corner, pushing the stretcher with movements that looked nothing like a nurse and everything like someone who had been trained for exactly this scenario. She didn't know he was about to destroy her career. She didn't know that in the next 3 hours, he would make a phone call to the administrator and file a formal complaint about reckless endangerment, that he would claim she had placed herself and the entire department at risk by approaching an armed intruder without proper training. She didn't know that by tomorrow afternoon, a security escort would be walking her out of Sacred Heart Hospital, and that the firing notice would cite her actions in the trauma bay as evidence of her unsuitability for a calm, professional nursing environment. For now, she was just doing the work. The patient was already requesting something to drink. Hannah had him positioned on his side, oxygen running at 3 liters per minute, the ice packs already in place against his femoral artery and axillary arteries. The cooling infusions were flowing. She was monitoring his core temperature on the continuous readout, watching it move down, 39.1. 38.8, 38.4. Getting there. "You're doing great," she told him. "Just rest. Let the medicine work." In a few hours, when the drug had worn off and he was lucid enough to understand what had happened, he would ask the other nurses who the woman was. And none of them would have a good answer. They had watched her transform. They had seen the command in her posture, heard the authority in her voice, recognized something in the way she moved that suggested this was not her first crisis. But they didn't know her. Not really. Not the part that mattered. That was the part she kept locked in a locker at the end of the shift, wrapped in newspaper, the leather worn soft by 30 years of use. The part that had walked through Marjah and Helmand Province and a dozen other places that didn't make the news. The part that had learned to save lives under conditions that would make most people quit humanity altogether. But she hadn't quit. She had just hidden. Dr. Hargrove emerged from the supply room exactly 47 seconds after security had the methamphetamine intruder sedated and restrained. His face was the color of old newsprint. He watched Hannah strip off her gloves with the kind of deliberate calm that came from having already made her decision, and his hands trembled as he reached for his phone. "You're suspended," he said, his voice cracking on the second word. "Effective immediately. Reckless endangerment. You approached an armed combatant without authorization, without backup protocol, without..." He stopped. Started again. "I'm filing a formal complaint with the board of directors." Hannah nodded once. She didn't argue. Hargrove's fingers flew across his phone screen. 3 board members he golfed with every Saturday morning at Hermitage Club would hear from him before the end of shift. Marcus Chen, the chief financial officer. Robert Sterling, hospital counsel. And Janet Whitmore, who served on the finance committee and had a daughter at UVA that Sacred Heart's donor network had quietly funded. These were men and women with skin in the game, men and women who had benefited from 3 years of unexamined equipment orders, phantom procedures, the $700,000 that had flowed into certain accounts under the guise of departmental upgrades. By noon, he would call the staffing agency that had placed her. By 1 p.m., he would leave voicemails so carefully worded they sounded like professional concern. I'm troubled by some recent behavioral incidents, episodes of what I can only describe as obsessive documentation patterns, psychological instability that concerns me for patient safety. The words would hang in the air like fog, toxic and unmeasurable. Impossible to disprove. Impossible to sue over. Just enough doubt to ensure that no other hospital would touch her. But that was phase 2. Phase 1 was right now. Hannah walked to her locker in the staff room. The space was empty, everyone else had scattered to other departments, other floors, anywhere but near her. Her combination spun through her fingers. 37. 14. 8. The door clicked open and there they were, the combat boots her colleagues had mocked, the one she had claimed belonged to her father. The leather was cracked from 20 years of Marjah dust, from climbing through compounds in Logar province, from walking past IED markers in Sanjin Valley. She had bought them new in 2004 at Fort Benning. She had buried 2 Marines in them. She wrapped them carefully in newspaper. The boots had survived 2 decades in a locker at Sacred Heart Hospital. They would survive this too. Everything survived if you kept it long enough. The intercom crackled. Trauma alert. Incoming Marine, gunshot wound to the left anterior thorax. ETA 6 minutes. Hannah's hand stopped moving. A Marine. Gunshot wound to the anterior thorax meant one of 3 things: pneumothorax, hemothorax, or both. If it was both, if the bullet had punctured both lung and blood vessels, the Marine's survival window was measured in minutes, not hours. 4, maybe 5 minutes before his blood pressure dropped below viable. His oxygen saturation would crater. His heart would eventually stop. She should walk out. She should take her boots and her employee badge and her carefully constructed anonymity and walk out the front doors of Sacred Heart Hospital and never come back. She didn't walk out. Her feet were already moving toward the trauma bay. Security tried to stop her at the double doors. "You're suspended." "I know," Hannah said. The words came out flat. "I'm not here as a nurse. I'm here as a witness. Let me stand in the corner and watch." The trauma team was assembling. 2 residents. 3 nurses. The attending physician, Dr. Marcus Webb, was still in the physician's lounge, 5 minutes away. The clock was already ticking. The Marine was already losing blood. Somewhere in transit, his oxygen saturation was probably already dropping. The stretcher burst through the doors at 4:38 p.m. 22-year-old male, entry wound left anterior chest, exit wound left lateral chest, BP 82/60 and dropping, respiratory rate 28, O2 sat 91 and falling. The trauma surgeon's voice rattled off the vital signs like a prayer that wasn't working. Hannah's hands moved on their own. She was reaching for the tray before her brain caught up with her muscle memory. The 14-gauge angiocatheter was in her fingers, a needle, nothing more, just a needle thin as a whisper. The Marine's second rib. The midclavicular line. This was the second intercostal space, the window where had collapsed his lung into useless tissue, where his heart was beginning to shift in his chest cavity like a door swinging on its hinges. "What are you doing?" one of the residents said. Hannah didn't answer. She didn't have time for words. The needle went in. She felt the pop, that specific resistance that meant she'd breached the pleural membrane. The hiss of air escaping from a collapsed lung, rushing out like a prisoner released from solitary confinement. The oxygen saturation monitor chimed. 89, 91. 95, the number climbing. The lung re-expanding. The Marine's chest rising and falling with the sound of air moving through functional tissue for the first time in 10 minutes. Sinus rhythm, the trauma nurse said. Her voice had changed. It was quieter now. More careful. The room went dead silent. Nobody moved. The attending physician hadn't arrived yet, but he wouldn't need to, not for another 4 minutes. For minutes that didn't exist 5 seconds ago. For minutes she had just purchased with a needle and 20 years of battlefield muscle memory. Dr. Hargrove stood in the doorway. His face wasn't white anymore. It was worse than white. It was the color of something that had been buried and wasn't supposed to be dug up. Security arrived at 4:41 p.m. 2 officers, hands on their belts, professional expressions that didn't mask the awkwardness of what they were about to do. One of them was Officer Ramirez, who had worked the ER for 8 years and had watched Hannah save lives 100 times without ever knowing she had actually lived one. "You need to come with us," Ramirez said quietly. Hannah nodded. She didn't resist. She didn't argue. She removed her badge from her scrubs and handed it to the nearest resident. "His pneumothorax is decompressed. The attending should do a chest tube within the next hour. Watch his output. If the hemorrhage is more than 1,500 milliliters, he goes to surgery. If it's less, he might stabilize." "Hannah," Ramirez said, and there was something like apology in his voice. She didn't look back. The parking garage was cold. Her car was where she'd left it that morning, a 2009 Subaru with a check engine light that had been on for 3 years. She sat in the driver's seat and gripped the steering wheel and did not cry. Soldiers didn't cry. They did what came next. What came next was the VA hospital downtown. What came next was the waiting room where she had sat as a patient every Tuesday and Thursday for the past 18 months, surrounded by the ghosts of men she had saved and men she hadn't been able to save, surrounded by wheelchairs and canes and the particular silence that only existed among people who had seen the worst the world could offer. She checked herself in at 5:13 p.m. 72-hour psychiatric hold. The forms were the same forms she'd filled out before. The intake nurse was kind, older woman, maybe 60, who didn't ask questions beyond what was required. Hannah had been a patient here long enough that the staff knew her name. Hannah had been coming to this waiting room long enough that the other veterans nodded at her like she belonged. She did belong here. That was the problem. The room they gave her was small and quiet. She sat on the edge of the bed and held her wrapped combat boots and thought about the Marine in the trauma bay, about whether he would make it through surgery, about whether he would ever walk again. She thought about Dr. Hargrove and his calls to board members, his voicemails to her staffing agency, his carefully constructed narrative about psychological instability. And then, at 6:22 p.m., the sky above Norfolk shook. The sound came first, a deep percussion that vibrated through the hospital walls like thunder that wouldn't stop. Then the rotor wash hit the windows. Not one helicopter. Not 2. 3. Black Hawk helicopters, coming in fast and low, their landing lights cutting through the darkness like sabers. Hannah stood. She didn't know why. Something in that sound. Something in that specific rhythm of blades cutting air, that was 160th SAW, that was Night Stalkers, that was a unit she knew the way she knew her own heartbeat. She walked to the window and watched the helicopters descend toward the hospital's rooftop landing pad. The intercom crackled. Security alert. Incoming military personnel. Secure the perimeter. The voice on the PA system sounded confused. Hospitals didn't get military landings. Hospitals didn't get Black Hawks dropping out of the sky on a Tuesday evening. Hannah held her boots and waited. The footsteps came down the corridor at 6:36 p.m. Not running. Walking. Measured. Professional. Military. She heard them before she saw them, boots on tile, the kind of synchronized cadence that only came from people trained to move as a unit. 1, 2, 3, 4. The door to her room opened. A man stood in the doorway. Early 50s, maybe. Gray at the temples. The kind of posture that came from 30 years of carrying a rifle. His uniform was dress blues. His eyes were the color of the Atlantic before a storm. Senior Chief Petty Officer Hannah Clarke, he said. His voice was quiet. His voice was a command. Hannah didn't move. She couldn't move. I'm SEAL Team 3, he continued. Captain Jack Holloway. I served alongside you in Marjah 20 years ago. Remember me? She did remember. She remembered him as younger. She remembered his call sign, Breaker, because he had a talent for breaking through obstacles. She remembered his laugh, which had been rare, which had meant something when it came. Yes, she said. There's a patient downstairs, Holloway said. Tension pneumothorax. You performed the decompression. Yes. He's awake now. He wants to talk to you. Hannah picked up her boots. She didn't know why that felt important. She just knew it was. The elevator ride was silent. Holloway stood beside her, and she could feel the weight of 20 years compressed into the space between them. The hospital corridors were different now. There were officers in dress uniforms standing in clusters, standing at attention, and they saluted as Holloway passed. One of them opened the door to the trauma bay. The Marine was conscious. 22 years old, chest wrapped in bandages, for lines snaking from both arms. He looked at Hannah and his eyes widened. You, he said. His voice was rough. You saved me. The decompression saved your life, Hannah said. The doctors will do the rest. No. The Marine reached out. His hand found her wrist. You saved me. In Marjah. You remember? I was 12 years old. There was crossfire. My leg was bleeding. You were. Hannah's hands went cold. Sergeant Martinez, a voice said behind her. Let the medic work. It was another Marine. Older. Translator's insignia. He was reading from a file, and as he read, his hands began to shake. Born Rashid Khan, Marjah District, converted status, he looked at Hannah. You're the medic who treated him. 20 years ago. You documented the shrapnel pattern. You requested a medical evacuation. You saved his life. The room was very quiet. And he remembers you, the translator said slowly. He remembers you because you didn't have to. You were under fire. You could have left him. But you didn't. Captain Holloway stepped forward. Senior Chief Clarke, your service to this Marine, and to this nation, was noted in every debriefing since 2004. This is Rashid Khan. He is now a DoD asset. He is now American military. And he came here tonight to thank you. Hannah's eyes were burning. But soldiers didn't cry. The room went so quiet you could hear the ventilator wheels squeaking against the tile. 3 bronze stars, another voice said. Hannah turned. An admiral stood in the doorway. 4-star. She recognized him from briefings long ago. Awarded for actions under fire. 2 purple hearts. For wounds sustained treating casualties in hostile territory. 1 silver star. The admiral paused. His voice dropped. For the Sanjin Valley, 2003. For holding a chopper's worth of Marines together while an entire compound burned. The doctors said you should have died. But you didn't. Hannah didn't move. She didn't breathe. And 1 more, the admiral said. A Navy Cross. For Marjah, 2004. For performing field medicine under conditions that would have broken most surgeons. For saving 17 lives in a 70-minute firefight. For not leaving anyone behind. The silence lasted 3 seconds. Then 2. Then an FBI agent stepped from behind the admiral and said quietly, your work in Marjah, Senior Chief, the medical intelligence you gathered, the patient notes you documented with that precision everyone called paranoia, that intelligence identified an IED network that had killed 43 Marines. Your documentation led to the network's dismantling. You saved hundreds of lives after you left the field. Hannah looked down at her combat boots. They were still wrapped in newspaper. Behind her, Dr. Hargrove was standing in the hallway. The color had drained from his face the way water drains from a sinking ship. Standing beside him were the board members he had called. Standing beside them was hospital legal counsel. Standing beside them was every person who had watched him build his career on stolen money and the assumption that no one was paying attention. No one moved to help him. "Dr. Hargrove," the Admiral said quietly, "you're going to want to contact your lawyer." 3 days later, the doors to the ICU burst open with a Level 1 trauma alert. Unconscious male, 32 years old, gunshot wound to the abdomen, brought in by federal marshals who didn't explain why. Hannah was changing the 4-bag on room for 12 when she saw the patient wheeled past, and that's when her hands went still. A tattoo visible on the man's bare chest. Afghan script. The kind she'd seen before. The kind that meant Taliban. The room held its breath. Hargrove was nowhere near the trauma bay. He was in his office, probably drafting another memo about her incompetence. But the attending physician was already barking orders, and nurses scattered like startled birds, suddenly very busy with other tasks, because a Taliban prisoner meant complications, meant politics, meant questions nobody wanted to answer. Hannah finished the for adjustment and walked toward room 407. She didn't hurry. She didn't pause. Her hands moved like water finding its level, the product of 20 years of compartmentalization. By afternoon, the patient had stabilized enough to be moved to a regular bed. Hannah wasn't assigned to him. She was cleaning a supply cart when one of the marshals approached her, asked if she had a moment. She followed him to the recovery room, and when she entered, the man's eyes opened. Dark. Intelligent. Fixed directly on her face. He whispered something in Pashto. 3 words. Her shoulders didn't move. Her breathing didn't change. But her hands gripped the 4-stand like it was the only thing keeping her anchored to this moment, to this hospital, to this life she'd spent 2 decades building behind a lie. The translator was summoned. A DoD liaison who'd been waiting in the hallway, already suspicious that something was off about this particular patient. He arrived within minutes, badge on a lanyard, the air around him carrying that particular frequency of federal authority. He listened to what the patient said. Listened to Hannah's name whispered in Pashto. And his face changed. His eyes went wet. "You treated me," he said. "In Marjah. I was 12 years old. Shrapnel from an IED. You tied off my femoral artery and you told me I was going to live." He pulled up his sleeve, and there it was, a surgical scar, pale now, running from hip to knee. "You saved my life when I was a child. Now I'm enlisted. Marines. And his voice cracked. He breathed, collected himself. "My son's sleeping in the waiting room. His name is Omar. He's 8. Hannah didn't respond. Couldn't. Her jaw was moving, micro-expressions flickering across her face like static, like her composure was trying to hold back 20 years of compartmentalization and failing. She reached for the patient's file with hands that had learned to be steady under fire, and as she read the documentation, the shrapnel pattern he'd described, the date of injury, 2004, the details aligned exactly as she remembered them. The 12-year-old boy from Marjah. She'd sewn him together with her own hands, in a medical tent during a firefight, with bullets breaking the tent poles and dust coating everything, and she'd never known if he'd lived. He was alive. He had a child. The room was tilting. Not the room. Her. She was tilting, and she had no mechanism left to stop it because this was the proof that her life before had meant something, that the decision she'd made under fire had echoed forward 2 decades and created a man who'd chosen to serve. The marshals came first. Then a colonel. Then a captain wearing the golden insignia of a SEAL team leader, someone whose face Hannah recognized from briefings in Camp Lejeune, someone she'd served alongside in the mountains. His name was Holloway, and he walked into that room with the kind of authority that made hospital staff straighten in his presence, and he looked at Hannah Clarke and he nodded once, like he'd just confirmed something critical. "That nurse right there," Holloway said quietly to the hospital administrator who'd appeared in the doorway, "is Senior Chief Petty Officer Hannah Clarke. She was my senior enlisted advisor for 3 operational cycles. She's got a silver star in her jacket, 2 Purple Hearts, and a commendation from CENTCOM for field medicine under circumstances that would break most surgeons. The administrator's face was color-draining white. An FBI agent appeared behind him, badge visible, and when she spoke, her words came with the weight of federal authority that made everything else in the building seem suddenly small. Senior Chief Clarke's medical documentation from Marjah in 2004 included intelligence on IED construction methods that we traced through 3 cells and dismantled an entire network. Her attention to detail, her exact notation of shrapnel patterns, blast radius, material composition, led to the identification of 2 bomb makers. That intelligence saved approximately 847 lives over the next 4 years. Silence. The kind of silence that fills rooms when people realize they've been standing next to something they couldn't see. Hargrove's office became suddenly crowded. Board members arriving without announcement. A hospital attorney with a briefcase. Military liaisons with classified clearances and expressions that suggested they'd seen the financial records already, the 3-year pattern of inflated equipment orders, phantom procedures, kickbacks channeled through vendors, nearly $470,000 in fraudulent billing, all of it threatened by a nurse who documented everything with the precision of someone trained to keep people alive under fire. Hargrove sat in his chair like a man slowly being buried alive. His hands were in his lap. His face had the color of something drained. An investigator was reading numbers from a spreadsheet, dates, amounts, vendor names, and Hargrove's lawyer hadn't arrived yet, and the FBI agent was explaining that falsifying medical records was a federal crime, that insurance fraud carried mandatory minimum sentences, that hospitals were required to report to the state medical board within 72 hours. When he finally spoke, his voice was different. Smaller. "I want to cooperate," he said. "I want to make this right." But there was no making this right. There was only the cascading consequences of choosing to destroy someone because she was competent, because her attention to detail threatened a financial arrangement, because she'd been trained to see details in trauma that civilian doctors would miss. 2 weeks later, the hospital's main lobby filled with press. Television cameras. Hospital staff lining the corridors. A Navy captain stood at a podium with Hannah beside him, and he spoke about service, about sacrifice, about the kind of heroism that doesn't look for recognition, that carries wounded Marines across deserts and documents intelligence that changes the course of operations. A framed commendation was presented. Hannah's hands took it. She didn't smile. She didn't cry. She simply accepted it the way a soldier accepts an order, with the understanding that the work is what matters, not the recognition. And in the back of the room, Dr. Hargrove was escorted out by security, his face captured by 7 different cameras, his name about to become synonymous with fraud, with the collapse of a medical career built on lies. 6 months later, Hannah was walking through a grocery store parking lot when she saw a man at a folding table covered in brochures. Supplemental insurance policies. Accident coverage. Long-term care plans. The man looked smaller than he had in his office. He wore a polo shirt with someone else's name on the pocket. When he glanced up and recognized her, something in his face broke. His hands shook as he fumbled with the papers. She didn't speak to him. Didn't acknowledge him. Just kept walking, her groceries in one hand, the knowledge that his medical license was suspended pending fraud investigation, that the state board was reviewing his conduct, that the federal prosecutor had offered him a plea deal that included restitution of $312,000. In her locker at Sacred Heart, the combat boots remained, wrapped in newspaper, weathered, real. But beside them, Hannah had placed a photograph. The 12-year-old boy from Marjah, now in Marine dress blues, standing beside her with his arm around her shoulders. In his other arm, he was holding his son. Omar. 8 years old. His eyes were bright, and he was smiling like he had no idea that the woman next to him had sewn his father together on a battlefield while shells fell around them. She'd come back to work 3 days after the commendation was presented. Not as a chief, not in the administrative position they'd offered her. She'd chosen her scrubs, her stethoscope, her position at the bedside where she could still do the work. The trembling that had threatened to surface when she read that patient's file wasn't fear. It was restraint. 20 years of it, finally released into the world. True class is what you do when the lights go out. And Hannah Clarke had been doing that work in the dark for 2 decades, not for medals, not for recognition, but because lives depended on accuracy, and that philosophy had always been worth protecting, even when it cost her everything. If you've ever been underestimated by someone who didn't know your true value, let us know in the comments. And if this story resonated with you, please like, subscribe, and hit that notification bell so you never miss a story about the quiet warriors among us.